Daniel, what are some of the major needs we have right now in Arizona as we speak here in May 2020?
Thanks, Paul. I think there are a lot of big issues that need to be resolved here in Arizona, especially during the middle of the pandemic. So, one of the biggest ones is really what's going on with our critical infrastructure, particularly when we're looking at things like hospitals. In Green Valley, we saw that the Santa Cruz Valley Regional Hospital was on the verge of closing. So, I had to partner with Governor Ducey and Kirsten Sinema, our state senator, to be able to get funding to keep their doors open. So we were able to successfully do that. But what we're seeing across the state of Arizona is lack of access to quality, affordable healthcare as one of the biggest issues that's impacting folks before COVID-19. But now that we're in the middle of the pandemic, it's exacerbating an already difficult situation for many Arizonans. That's why I've been working with my colleagues to try and do what we can to expand healthcare options, but also doing things to shore up the actual providers. Right now, the governor is sitting on about $1.5 billion of federal dollars to help provide funding to healthcare providers during the pandemic, and he hasn't given out that money. So we're pushing him to give that money in an equitable way to make sure that all hospitals and clinics that are using and providing resources during COVID have what they need, and not just keeping that money up in Phoenix or in Tucson.
Right.
I think that's number one. And then number two, I think we need to do a lot more to shore up the social safety net. So in Arizona, the maximum dollars that somebody can earn for unemployment insurance is $240 a week, which I don't know where the people who think that you can afford to live off of $240 a week live. But I know that in Arizona in 2020, that's not enough to maintain a roof over your head, let alone, be able to buy groceries and provide any money for things like healthcare and some of the essentials. So I think those are the two biggest things. What are we doing to protect and to provide access to healthcare for folks? And also, how are we making sure that that safety net is not completely broken? Senator Sinema has been pushing for us to double the weekly payout. Thankfully, because of the federal CARES Act dollars, there's an additional $600 going right now to Arizonans. But the DES, the Department of Economic Security Systems, are 2 decades overdue for an upgrade. So people are having issues even applying for the unemployment insurance, let alone actually getting them.
Okay, let me ask you concerning the first point you made. All right, it was already difficult for some people to afford health care previous to this pandemic, right? If they didn't have health care or if they had big initial payouts
or deductibles,
deductibles, let's say they had that, right? But now they would have to have testing. Let's say somebody had to go to the hospital, which is very expensive, or they had to go to the emergency room. They might have to spend 4 or 5 days in a hospital.
Or longer.
Without maybe 2 weeks, maybe longer.
Right.
I have a relative that is, the last I knew, 47 days suffering from this.
Wow.
But not in a hospital, but let's just say that they were in there for, let's take a week. Before this pandemic, staying in a hospital for a week would be extremely expensive.
Right.
And that's if you're covered. It may not cost you that much, but what if you weren't covered adequately? How is that affordable to anybody? Right. The testing has got to cost something. Seeing a doctor has got to cost something. The medication has got to cost something. How is that all affordable? How do you see that happening?
Right. So I think there's a couple of different things that we need to do to address the question that you're bringing up of how do we make sure that if someone gets sick, they can afford to get sick?
Right.
I think that's the challenge that we're facing. So one, we need to make sure that we do what we can to open up eligibility for folks to be able to have healthcare insurance, either one that's provided by the exchanges and the Obamacare, the ACA exchanges, and opening them up so that people can apply outside of the regular enrollment periods. But also, we need to make sure that if someone gets sick and loses their job and potentially loses their healthcare provided by their employers, that they don't see a lapse in coverage. So at the state level, I know right now one of the things that we've been looking at is coming back in a special session to deal with what happens if someone gets sick and how do we make sure that we have the funds available to pay for it. We know that there's a lot of federal dollars coming in to shore up state budgets, and the state Medicaid system, which is the state access system, the Arizona Healthcare Cost Containment System is one that has really been a gold standard around the country for what a state Medicaid system should look like. But it's one where we're encountering people not knowing how to apply and what they might be able to qualify for. So I think the first thing that we need to do before we address anything legislatively is really work on the public education front to make sure that folks know what resources are available to them. So the thing that I always encourage folks are, if they're having an issue and they can't enroll in access, or they're having challenges with unemployment insurance, to call my office or to reach out to me via email at the legislature. And that email is dhernandez@azleg.gov. Again,
could you repeat that for people?
Yeah, again, it's dhernandez@azleg.gov.
Okay.
So that's the email where if someone sends me information, I can follow up on their behalf with a state agency. And then the phone number to call my office up in Phoenix, because that's where my assistant can take the message down if I'm not in the office. And because it's in Phoenix, I'm not there every day, but I check in with her very regularly, is 602-926-4982. Again, the telephone number to call is 602-926-4982. So there's going to have to be a little bit of federal funds that we're going to have to get to help provide funding so that folks who either lose their coverage are not being held responsible for a $500,000, $2 million hospital charge after they get sick. But I think there's a really big question that has yet to be answered on how much additional federal funds we will get, because the state of Arizona, quite frankly, doesn't have a ton of money right now. We're looking at a $1.1 to $1.6 billion budget shortfall. So if we were to try and provide resources to alleviate some of those payments that folks need to make if they get sick, I don't see how the state would be able to cover that without additional support from the federal government. And I'm working with our federal partners to really advocate so that if someone gets sick because of COVID, they're not having to pay anything out of pocket. But that's going to be a big challenge moving forward. We're seeing Nancy Pelosi and the U.S. House pushing through a $3 trillion relief package that is now stalling in the Senate. So we're probably going to see negotiations back and forth and see that number come down. But one of the things that has to be a priority is providing actual relief to those who get sick. And I don't see a ton of that happening at the state level unless we get additional dollars from the feds.
I'm going to ask questions that people in the audience might be thinking about, and I might, hopefully I ask the right questions. I don't know if people understand the size of the costs of this. Doesn't pretend that one person is sick for a few days. That could cost $500,000 to $1 million. Extrapolate that toward all the other people that are sick in this state and other states and other places all around the country. We have over 1 million people sick. We have about 100,000 have died. I figured that counting to 1 million, like this, 1, 2, 3, takes 11 days to count to 1 million. It takes 32 years to count to 1 billion. It takes 32,000 years to count to 1 trillion. So 1 trillion is not some small amount.
Right.
And even 1 trillion sent out to people to help them during this kind of a crisis doesn't last all that long with the number of people that need help, correct?
Correct.
3 trillion may or may not be enough. Where does the money ultimately come from, since we had a big tax cut, et cetera? Where does that money come from?
Right. I think you're asking a really important question, which is how do we afford to pay for these immediately necessary uses of funds to relieve the pain and also the potential financial burden on people if they get sick, or because someone in their family gets sick. Because what we're also seeing is a lot of people who are the primary breadwinners who are getting sick. So you have other folks that are dependents on them who are now unable to be able to pay for things like rent,
Right.
other things. So one, at the federal level, Arizona's been leaving money on the table for a really long time. And we actually just passed a bill this year, House Bill 2668, that would require the Department of Health and the Arizona Healthcare Cost Containment System access to administer and collect an assessment on hospital revenues and bed days for inpatient and outpatient services. And it would establish something called the Healthcare Investment Fund, because what it would do is it would actually draw down additional federal dollars, upwards of $1 billion that the state of Arizona has been leaving on the table.
Yeah.
So to care for our citizens for a long time, hospitals have been saying, give us an assessment and we will pay it ourselves to be able to draw down additional federal dollars, because we're literally leaving money on the table that could be used to pay for indigent healthcare or healthcare for people who can't afford to pay for it themselves. So I think that's one of the big things, that we need to fully utilize every tool in our toolbox. But because of the Republican majority in the legislature, for a long time, there's been a hesitancy to say, we will use these federal programs. Another example is we had a $50 million program that would provide childcare subsidies for the state of Arizona so that people could go back to work, that my Republican colleagues in the legislature refused for years to approve. And then when we approved it, everybody pats themselves on the back and celebrates, oh, we did the great thing of giving, people childcare subsidies. So we need to take advantage of every federal dollar. Arizona as a state is not drawing down as much as it could and should be utilizing, to the great disservice of those who are the poorest and the most vulnerable in our communities. Secondly, while we do have a concern about the national debt, I think right now when people are literally dying, the last thing we need to worry about is how we're going to pay for it later. There are plenty of tax cuts that could be repealed. We saw the big Trump tax cuts in 2017 that put a huge hole in not just the budget of the federal government, but also at the state level. We saw that we couldn't have certain things be taxed anymore. So we need to make sure that we take a hard look at the taxes for those who are the highest income earners and say, okay, we understand you've been paying a lot in taxes over the years, and then you took a dive because of the Trump tax cuts. We're going to need to have you pay a little bit more of your fair share, because right now we need to make sure that people are staying alive and that they're able to feed their families. And I think that's something that there are a lot of proposals out there on how we do that, but we're seeing at the state level things like the Invest in Net initiative to try and provide funding for education by taxing people who make more than $250,000 a year.
Right.
I wouldn't be surprised if we see an initiative of the same type to help provide health insurance and other funds to help offset some of the potential costs of healthcare in the future.
That even if the people that are the big time earners, even if they pay 10%, it would be something, because they have ways of not paying taxes, right? Many, many, many ways.
A lot of the people that do the deductions and take different things, there are a lot of different things that can be utilized. So most people are not paying that full percentage point. So they find ways to chip away at the overall fee. So it seems on its face like, oh my God, there's this huge tax bill that they're getting. But that's why a lot of these folks have professional accountants, wealth advising managers, lawyers who look at their information and say, you can take advantage of this tax cut over here and this over here, and your final amount that you pay is this lower amount instead of, what is advertised as being an outrageous amount by a lot of folks on the right.
Right. Well, many pay zero. We know that,
Exactly.
right? So, I was going to say, so think about the implications if we get 200 million people sick. Let's just say half. Let's say half the people in the country. Right. Let's say that we have 200,000 or 300,000 people dying, but the people who just get sick and need care it's tremendously expensive. And then let's say that the economic situation gets even worse than it is now, where it's going to be 15 to 20 to 25% unemployment, correct? Right. Right now it's about 15, or is it getting worse?
It's a little bit worse than that in Arizona. What we're
Right.
seeing is a lot of the folks who are getting sick, about 19% are actually needing to be hospitalized.
Yeah.
So if you take out, say there's 9 million people in the state or 7 million, and you draw down that number to 17 to 19% that are actually being hospitalized. And of those, you get people who have the most expensive cases because they're on ventilators and in the ICU.
Right.
That's easily the millions of dollars.
Oh, yeah. Right. So it's a tremendously expensive situation, and many people will not have money to pay their rent and their food and their medication and their insurance or anything. So there's no choice but to maybe even create money, so there will be enough for people to survive, right, for a while until this lessens. And we don't know, with this particular disease, we don't know that much about it. When's it going to end? We don't know. There won't be there may or may not be a vaccine. What's the presidential medication of choice right now?
Hydroxychloroquine.
Well, that's probably not going to work. That's probably not going to stop it. There's a question nationally as to when we should be starting over and coming out of this pandemic situation. When should the economy be restarting? What are your thoughts about that, as far as people who think we should be restarting and maybe think it's not even a problem, and then the people who are a little more cautious? What are your thoughts?
Right. I think what we're seeing right now on May 22nd of 2020, because things change sometimes minute by minute or day by day, is that your partisan ideology and where you get your news is way more indicative of how closely you are taking precautions than almost any other thing. So we were just in the State House this week to sine die, which means to finish out the session and to adjourn. And there were colleagues of mine who were joking, fake coughing on people, not wearing masks, not being socially distant from each other, and not taking any of the precautions that the CDC and a lot of folks who are much brighter than I, including Matt Boyd, who did a great interview with you guys a couple days ago, talking about why we need to take precautions like wearing face coverings and masks. What we're seeing on the other side is folks who are generally left of center who believe that we have not really gotten to the point where we can reopen the economy because we have not necessarily hit our peak in Arizona. But it's not just something that people who are, I think, lay people are thinking about. It's something that even the Department of Health is talking about. There was a press conference about a week ago where the director of the Department of Health, Dr. Kara Christ, was asked, has Arizona hit its peak? And her response was, we don't know. So if we are in a situation where we don't have enough testing to ensure that everybody that needs a test can get a test, because we're still not there, and we're not in a place where the antibody test is reliable, because we're actually seeing that some of these antibody tests could have a failure rate up to 60% or even higher, depending on where it's from, how it's processed. So we don't know, one, if the infection means once you've had it, you can never get sick again, like a lot of other infections, like the chicken pox or the smallpox. We don't have a vaccine, but we also don't know if we've reached a point where it is feasible to reopen without seeing a secondary spike. Arizona has been lucky that we've been spared the most part, but if you look at the Navajo Nation up in northern Arizona, their infection rate per capita is worse than even New York City. So there is a problem that's happening in Arizona that we can't deny. So I think to reopen the economy fully right now would be irresponsible, and that's why I've been advocating for us to flatten the curve. And until we can get readily available testing for every Arizonan that wants it, and to then make sure once we test people that if we identify someone that's positive, that we have a way of keeping track who they've been in contact with, who they might have exposed. We're seeing a lot of people that are asymptomatic that are spreading this who don't even know that they're sick. So until we're able to do that, and until we hire staff at the Department of Health or at the county health departments to be able to do that, I think we cannot reopen fully, because if we do, we're going to have people going out there thinking, oh, I don't feel sick. Meanwhile, they're a super spreader who is potentially getting other people sick. I was just at a restaurant here in Phoenix because we were in session picking up takeout. This is only a couple of days into restaurants being allowed to have people be in dining services allowed. And there were about 40 people in this restaurant. There was one table that had about 15 people, no one wearing masks, no one enforcing any kind of rules or social distancing. I called the gym that I go to occasionally up here in Phoenix to find out what their rules were. And they're like, oh yeah, just come on in whenever, just try and keep your space from people, but nothing's really changed.
Really?
So what we're seeing is a lot of folks who are business owners who are not instructing their employees with enough information or the correct information. So people are saying, oh, we're reopened, it's back to normal. And I think that's the thing that we need to really be careful with.
How do you see the curve going right now? And you talked about flattening the curve a while ago. Is it on the down slope, or is it flattening, or what's it doing? Do you know?
It's really difficult to tell. And the reason why is we are doing something that is not being advised by epidemiologists. So we are combining our active PCR test, which says you have an active infection, with our antibody test. So the University of Arizona, I think, is one of the leaders on antibody testing, and they're doing a great partnership to try and figure out how many of our healthcare providers have been sick and potentially have antibodies. So that's a good thing. However, when you combine the number of antibodies and the number of active infections, it can kind of skews your data. So what we need to be concerned with is, what is the actual number of people that are currently infected and are sick with COVID-19, not how many people do we think have had the infection and how many people are currently sick. So when the question is simple, have we flattened our curve? Have we hit our peak? It's really difficult to tell right now, because we are aggregating data that shouldn't be aggregated, and we don't have a great data set yet. That's why earlier today I was on the phone with the governor's office working to try and get additional testing down in Santa Cruz County, because we're seeing a huge rise in infections down in Santa Cruz. But then when you look at the numbers, they may also be skewed, because the only people that are allowed to be tested right now, because of how few places are testing down there, are the people who are the sickest. So if you show up to the hospital, or if you show up to Mariposa, which is the healthcare center down there, and you have every symptom, they'll test you. But if you show up and you don't have the symptoms because they don't have the capacity, they're not going to test you. So you're much likelier to have the infection if you show the symptoms and you're coming in and basically opting into testing, than if we had a wider ability to test a larger part of the population.
Right, and you could be asymptomatic and still have it.
Exactly.
Cochise County, last I saw, didn't have many cases that they knew of, or very many deaths, did they? But maybe that's changed over there.
And that's the thing, that if we don't have adequate testing, it's hard to know who's actually infected. And for a long time, it was city by city, county by county before we had a statewide order. So they were saying, well, La Paz County doesn't have any infected people. And I said, no. It's not that they don't have anybody infected. It's that we haven't tested anyone yet that is infected.
I think one of the key things about this whole situation is people really don't know what this virus is. I mean, what it does and how to get rid of it or anything. It's a mystery, because it's a new thing. The last thing I'll say is, if you read the book about the 1918 pandemic, this is very similar.
Right.
They tried for a long time to try to find out a way to categorize this and to stop it, and to find not a virus, but a vaccine. They really never did, and it just kind of stopped after it killed 600 and some thousand people in this country. And I will say this too, for those who want to know a little bit more about virus, antibodies, and that kind of thing that Daniel was talking about, see the Matthew Boyd video on YouTube. Matthew Boyd discusses COVID-19. It tells you a lot of information about it.
Right. I watched it. Thank you so much for sharing, and I'll be sharing it out later today.
Yes. Okay, we'll stop for now. Daniel, I think you've given us a lot of information.
If folks have any questions, they can give a call to my office and we'll follow up if they have any assistance that they need with any of the state agencies, or if you need help connecting with our federal partners, I'm happy to be the pass-through to the federal office as well.
All right, and thanks for staying on top of things.
No, thank you so much. Sorry for all of the craziness, but thank you for taking the time to talk to me.
It worked out. Okay, thanks.